The other study that you're asking about, we had done a randomized trial for infants with ALL, and infants with ALL have a very poor prognosis with standard chemotherapy. And the goal of the trial was to try to improve that outcome by adding a FLT3 inhibitor to standard chemotherapy. So FLT3 is a tyrosine kinase that is overactive and driving this subset of infant leukemia with infant ALL. When we got the primary results of the trial, we were disappointed that the FLT3 inhibitor did not improve outcomes on that experimental arm relative to chemotherapy. The results that we're presenting here is a follow-up looking for biomarkers of perhaps why those patients didn't respond as well as we would have liked. And what we did in the laboratory was we took the patient's blood at various time points and their bone marrow before they started the FLT3 inhibitor, and we tested to see whether the FLT3 signal was actually inhibited in patients pharmacodynamically. And then we took their leukemia cells at diagnosis and studied them in laboratory to see if they were sensitive to the FLT3 inhibitor ex vivo. And when we looked at the survival of the patients that had received the FLT3 inhibitor, there was a strong correlation between achieving FLT3 inhibition in pharmacodynamics and in being sensitive ex vivo for their leukemic blasts and a good outcome. So when we actually looked at the patients who achieved those criteria, they did much better than the patients on the chemotherapy arm. But unfortunately, it was only 25% of the patients who achieved those criteria. So what that means to us moving forward is that if we were to do this again with FLT3 inhibitors, we should first of all use this biomarker to select patients most likely to benefit using the ex vivo sensitivity, which is a 48-hour assay. And then we should do intra-patient dose escalation to make sure that the patients who are potentially responders actually receive enough of the drug to turn off the signal. And that will be the follow-up, I hope, of this study, is that it shows that you can use laboratory-based studies to try to make sense of results. And even a negative study we can learn something from if we incorporate the laboratory.